Shrea.
Emek, thank you so much for having me, and UCARE for you. Thank you for the invitation to speak. So I'm a dermatologist and a clinical psychologist practicing in Mumbai, India. And as we know, psychodermatology is not a formalized branch, but I find more than ever the need to incorporate, as Professor Anna was saying, the need to incorporate at least asking the patient about it. Because often I think when a patient comes with a skin issue, we are the ones who need to filter out whether they need more help or not. And I think if we are so stuck in our, regimented prescriptions and we don't even think to ask them, we cannot take the next step forward of maybe referring them to a psychiatrist or a psychologist, or even just having a chat with them. So I personally, in my clinic, have started administering some questionnaires, having a chat about what's stressing the patient out, or even just giving them a patient listening. And today's presentation is not very scientific in terms of quoting a lot of studies or a lot of statistics. I have just tried to incorporate things that I bring to the clinic on a daily basis, and I find that urticaria patients benefit from it. So maybe we don't find it in a lot of research articles, but I find that on a day-to-day, people respond well. So I'm going to get started. I just want to confirm that you're able to see the slides properly.
Yes, we are seeing them properly. No worries.
Thank you. All right. So the mind-skin connect, as we call it, and here is a dizzying number of issues and disorders. You know, the list looks very intimidating when you see it. So I don't want you to get worried trying to decode this. Let's move to this word urticaria. Now, as Arzu said, the first doctor she met said, oh, it's just a skin condition. But when you delve further into urticaria and you see how it's affecting the patient, and this is just the psychological effects. We haven't gone into the other systems. Just psychologically, as Professor Anna was also saying, sleep, the first thing that takes a hit. Now, even if the patient didn't have urticaria, we know that not sleeping well can lead to anxiety, can lead to a mood disorder like depression, can lead to an adjustment disorder, which can make you more paranoid and with an OCD kind of tendency. To calm yourself down, you may resort to taking substances. Not everybody resorts to researching their condition like ours, though, right? We know a lot of patients who take to other forms. So there you have it, substance disorder. And then you're in a loop of low motivation. And what did you have to begin with? Urticaria, apparently a simple skin rash, apparently a simple skin condition. So my purpose in mentioning this was that it really does affect our psyche and our skin. And it's visible to us here because we think that the response is happening down here, but we know that the brain is getting involved, that our neurotransmitters are getting involved. And Professor Emek, your paper on the substance P and how you find it in psychiatric conditions and the overlap in the histamine release from the mast cell. I mean, that's what more do we need to understand the association? So the point is, we got to get more than skin deep. And Professor Anna's already taken us through the evaluation. I'm going to take you through some psychological tools, lifestyle measures, and some pharmacotherapy. Now, again, a dizzying list. We're going to go through some of these. Let's begin with habit reversal. Now, I find that simply people not creating more of an itch is a great place to start. So let's say you've got a small hive that has popped up. I think the patient's tendency is to immediately go at it and scratch, because it gives you that sense of gratification. It gives you that sweet itch, as they call it. Now, here I incorporate habit reversal to tell them that they've got to pick another behavior. So it could be keeping something nearby to squeeze. It could be pulling their ear basically very far away from the site where they are getting the problem. So let's say the urticaria outbreak is on the hand. You move either to something outside the body, that's preferable. So you want to tell them that they need to reverse their habit of itching with something that is desirable, something that is not going to damage their skin. So common phrases that I use, which we came across in the SDAP program too: use your paw, not your claw. So do not scratch with your nails. Use the palm of your hand if at all. Uh, ice, ice baby is your mantra. You really want to, not for somebody with cold urticaria, of course, but in other forms, you want to soothe that area. Now, I want to, I was thinking about this slide when Arzu was showing the extent of involvement. Of course, these measures will not apply to such widespread areas where we know that it's such a large involvement. But I find that people with a few patches of urticaria, if they're not told these things, they really worsen their own condition by scratching. So we move to behavioral attention therapy, where we find that once urticaria sets in, the person tends to sort of get really fixed on the fact that urticaria is occurring. And all their actions are directed towards just the urticaria. I feel like it takes over their life. And of course, they're experiencing the mood fluctuations and, anxiety and depression, but they also stop engaging in things that could make them feel better. So if you start here, when you don't engage in pleasant activities, you don't feel pleasure. And when you don't feel pleasure, of course, you have a dip in your mood. So somewhere, giving the patient a cue that even if there is urticaria, do watch something that you like watching. Do step out maybe for a walk. Do talk to a friend that you like talking to. Engage in a pleasant activity just so that your experience is slightly higher in pleasure and your mood improves. And I think this ties beautifully with the alexithymia study that was just shared about. I want to take a minute to share this audio with you. When I was researching for this presentation, I found a lovely audio on attention-based training, and I did it for a couple of minutes, and I was surprised at how much of a difference it made. I of course, got impatient after a bit, but I want to request everybody who's listening in to take a minute to close their eyes. I'm going to play the audio. Just focus on the gentleman, what he says, the cues he gives you. There'll be a sound playing, and we'll all just close our eyes and pay attention for a minute.
Focus on the sound of the waves. No other sounds, thoughts, or feelings matter right now. Focus all your attention on the waves. Focus on the sound of bells. Birds. Dripping water. Waves.
It's back to me. So just a quick example of how focusing our attention on one thing, one sound, even though the clutter of many sounds, many people, many thoughts will always be there, but attention-based training is a great tool to help calm down the mind. And I like to tie this into the concept of chronic inflammation in the body, where sometimes the patient will ask, if I do this, will the urticaria go away? No, it's not as direct a correlation as that. But over time, we know that these kind of tools combined with breath work, meditation, yoga, CBD techniques, all of this reduces the levels of inflammation in the body. And we hypothesize that the cytokines, the inflammatory mediators also reduce over time because of these techniques that we use on a consistent basis. So it's not a pill. It's not a medicine. Doing it for a minute will not make the urticaria go away, but over time, it will help the state of chronic inflammation in the body. I'm sorry. And then, diversion versus distraction. So begin with distraction. If you're in an outbreak, distract yourself, put on the TV, put on some music, just take your mind away from it for that moment, just that moment. Don't think about the next hour, the next day, the next year. For that, we have diversion therapy, where you make sure that you're engaging in other forms of things that bring you pleasure, maybe a form of art, learning language, a dance form, socializing in a way that doesn't make you feel embarrassed, picking an activity that you can do by yourself, maybe. So a distinction between distracting yourself, which is in the moment, but also diverting yourself long term. And grounding, I think this is a beautiful ritual to do every day. Maybe when you wake up, notice 5 things that you see, 4 things that you can touch, 3 that you can hear, 2 that you can smell, and 1 that you can feel. And I've had a few patients notice, write down these things in their journal. And I think it just brings together the attention, makes you a bit more mindful. And as they start practicing this on a routine, even if the urticaria is not getting better, they are getting better with the urticaria. So not necessary that the skin condition is improving without the right drugs, but your coping mechanism, your ability is slowly improving. Jacobson's progressive muscle relaxation, I love this one. And what for me is really interesting is how much of a parallel it has to yoga, which is something that we practice so much in India. So PMR, progressive muscle relaxation, is a technique where you tense each muscle group. So you tense, for example, your hands, 1, 2, 3, 4, 5. So, that area is completely tense, and then you let loose slowly. And you repeat this for each muscle group. So, start with your feet. The points are marked here. Left leg, buttocks, right leg, stomach, go upward, and repeat this round in the body. For us, this ties in with something called the corpse pose in yoga, where shavasana, shav means the dead body, and asana is posture. So we practice it where you probably trace a light going through your body in the same order, bottom to top, and you keep breathing. Make sure you're completely relaxed, not tense. There are a lot of wonderful audios available on YouTube for the progressive muscle relaxation or the shavasana. I find it particularly nice for patients at bedtime because it helps them ease into sleep. This is a lovely article in the Department of Physiology on Shavasana and how they measured your cardiovascular function, melatonin secretion, concentration, memory, the effect on how tired someone was feeling, the headaches that they were experiencing. So once again, like I said, all of these things improving the body overall, not necessarily the skin, but the body overall. And we know that, yoga is something that Sanskrit says is for us to unite. So you unite with the universe, your mind unites with the body. And how they practice it is through postures. These days, there are some fancy names for it, like cat and cow, child's pose, cobra pose. But essentially, when you're holding your muscles in certain poses and coordinating it with your breath, you are performing vagal stimulation. You are causing parasympathetic release and secretion. And that is what is helping calm down the system and again target chronic inflammation. This is some breath work. If you'd like to take, a screenshot, and if you just put this on YouTube, there are several tutorials taking you through, like I took you through the attention-based training with an audio. So all of these with the audio will guide you through what kind of sounds you need to make. And it's incredible. The first one, called Brahmari, is where you close your ears and you like a bumblebee does, you just do, and when you close your ears and you hear that sound kind of vibrate in your mind, when you open your ears again, you're like, wow, what was all the fuss about? Everything is so calm. And this is something I personally do. So, I think I can vouch for it. We know Dr. Andrew Weil's 4-7-8 breathing technique. This is, has a more scientific approach. Inhale, hold, exhale, again, calms the system down. Oh, sorry, this is repeated. And just some quotes from, the University of Purdue, where they have an institute on yoga medicine, and they're trying to study it more and more because they're trying to also see how can we reduce drug intake by patients and introduce measures that they can perform on a daily basis themselves. So I love to, some of these quotes about how it increases your perception. It increases your understanding between when you're feeling safe and fearful, what is dangerous for your body, what is safe for your body, increasing your vagal tone, things like that. And we know, of course, cognitive behavioral therapy, where we challenge thoughts and we challenge why those thoughts are creating certain emotions in our system and how those emotions are making us behave a particular way. And that behavior is once again reinforcing our thoughts. Now, I find that CBT long-term very, very useful because urticaria is one difficult situation. We don't want that the coping mechanism that a patient is using in urticaria is something that they use in other difficult situations of life too. So once again, CBT will not reduce urticaria, but overall, it will help you cope with anything difficult. And a great study which compared yoga with CBT and psychoeducation. So yes, CBT statistically more significant than yoga. So maybe a combination of both these things is the best going forward. I find this useful if there is a specific trigger for a patient. I had one patient who was getting triggered when she was called by somebody that she was scared of. So she would get the call and she would break out into hives. So we replicated systematic desensitization where she's in a safe space in the clinic and we are imagining her getting the call, imagining the scenario, and then breaking it down so that when she's actually facing the scenario in real life, her body is prepared for it. And over time, she did start having fewer outbreaks. But this is very specific when the trigger is very specific. Once again, what Dr. Anna was saying, I find that we have to go back to the biopsychosocial model. We have to incorporate everything like support groups, your family, your movement on a daily basis, your enjoyment, maybe getting a pet, a house plant, but sort of incorporating it in the biopsychosocial model and not just treating it as a skin condition. This is a sample of journaling work that can be given to patients. Dr. MX study is so useful. I really enjoyed reading this one. So we know that certain drugs can help, and they've quoted a lot of articles where SSRIs, opiates, benzodiazepines, TCAs been given to patients, and they have found that especially where people were tested through the tools, through the evaluation measures, and they were found to have anxiety or found to have depression and then given psychotropic drugs, it helped reduce the urticaria. So in conclusion, we know that a lot of studies have found that giving psychotropics can be useful, especially when there is a pre-existing psychological condition. We are not sure if just giving these drugs can cure chronic urticaria. So can you just have an SSRI and fix urticaria? Probably not. So yes, a few things still left to figure out, but I think this is a good place to start. Thank you so much for all the work that you all do in the field of urticaria, and it's a joint effort. It's a joint effort. Thank you. That's me. In case anybody has any questions, feel free to get in touch.
Thanks. Thanks, Shrea. That was wonderful. So we learned a lot about how we can calm down our bodies. And I think this is also so useful for our patients to learn